tract consists of the mouth, nose, the trachea, which is also known as the windpipe, the bronchi, the pharynx, the larynx, and of course, our lungs. They engage in gaseous exchange as we take in oxygen and breathe out carbon dioxide. Hello everyone, welcome to this edition on Body Gist. In this edition, we want to look at habits that endanger our respiratory tract, habits that we engage in that causes danger or harm to our respiratory tract. If you are just joining us, click on the subscribe button on your screen. Subscribe to our channel so that you do not get missed out when we upload new videos. You can also like and share our videos. Drop your comments. We shall be there to attend to it. Follow us on all our other platforms. We're on Twitter, Instagram, and Facebook. I remain your nurse midwife, Sister Augusta Ozon, a sister of St. Louis. Do not go away. We shall be right back. Welcome back. What are the habits that endanger our respiratory tract? First, smoking. You have heard the Federal Ministry of Health warning us that smokers are liable to die young. Here are the reasons. The smoke we take in, which is cigarette smoking, contains some components such as carbon monoxide that displaces the oxygen we breathe in. Carbon monoxide displaces oxygen, making oxygen not to get to the vital tissues. Let us not forget that oxygen is essential for life. When oxygen do not get to vital tissues, it impairs the functions of such tissues such as our brain, our heart. Then, cigarette smoking also contains nicotine. Nicotine is an addictive substance. This is the reason why people who smoke always want to smoke more, because they are already addicted to it. It also contains the brown substance known as tar, TAR. These substances, when they get to the lungs, they cause damage of the lungs, predisposing smokers to cancer. This is the reason why governments will tell you that smokers are liable to die young. Aside cigarette smoking, there are also smokeless tobaccos that impair our respiratory tract, such as chewing tobacco or snuff. Snuff are sniffed into the nose, then it gets to the lung through the respiratory tract. It can cause impairment in breathing and predispose the individual to lung disease. Tobaccos are also placed on the teeth. It causes staining of the teeth. It causes abrasion of the teeth, that is eroding of the white part of the teeth. Then it also causes cavity in the teeth. It can also predispose the individual to bad breath, and it can predispose the individual to oral and gum diseases. Secondhand smoke or secondary smoke can affect an individual as a person who engages in smoking. What do I mean by secondhand smoking? Secondhand smoking is gotten from people who are smoking, though you are not smoking yourself. But when you are with somebody who is smoking, the cigarette smoke the person is holding, you can inhale it. Or when the person smokes and puffs out the smoke, once you inhale it, it can affect you as somebody who is smoking directly. So, when you move with people who smoke, you are doing yourself a lot of harm and danger. Individuals who engage in bush burning, forest burning, refuse or waste burning should also know that they are endangering themselves when they burn such refuses. This is because each smoke that we inhale contains carbon monoxide that displaces oxygen and prevents oxygen from getting to the vital tissues and performing the essential functions that it does. Another group of persons who endanger their respiratory tract are persons who are addicted to using nasal inhaler. This nasal inhaler, when used, gives you temporary or short-term relief by decongesting your nostrils. After that, it will cause more congestion in your nose. Then it will also make you more allergic to respiratory infections. Nasal inhalers are also sources of infection because you might not be able to keep them clean or keep them away from sources of infection. These nasal inhalers also help pox the nose and destroys the normal lining in the nostrils.
Do you know that a bad posture can affect your respiratory health and breathing? Sitting and slouching in the chair impairs breathing because it does not allow the diaphragm to expand during the respiratory cycle. Sitting up straight and supporting your back on the chair is a good posture that aids your breathing.
Our aim at Body Gist is to help you live improved lifestyles. Please keep away from cigarette smoking. It endangers your respiratory tract. If you move with people who are chain smokers, you are as good as inhaling the smoke itself and endangering your health. When you burn refuse or bush, please get a mask over your nose. If you have respiratory tract infections, visit your physician to get the best and adequate treatment. Stop being addicts by using nasal inhalers. Thanks for always watching our video. Please do not forget to share and like this video. You can drop your comments. We'll be there to attend to it. I remain your nurse midwife, Augusta. Keep following us on Body Gist while we keep giving you the gist.